Right, ladies and gentlemen, good morning from sunny North Wales here. I am nice to see you all again. This morning, we are going to concentrate on not the most inspirational of subjects, but it's basically, the foundation of what you need to know is how to counsel people. Counseling skills, we call it active listening skills, okay? Counselors, as you know, we don't give personal advice. We make suggestions, but we also have to go through a process of exploration. We have to explore the client's world. As we explore it, we need to start to understand what's going on. This is the empathy part of by the way, if you see me looking to the side, I like to look at your faces instead of the camera. So if I do appear to be looking sideways, I'm looking directly at the screen with you on, you say. So we need to understand, this is where the empathy part of it comes in. We need to understand, it's very easy to understand another person from our perspective. It's not so easy to understand another person from their perspective, because it means putting yourself aside, and that takes time and it takes skill, quite frankly. Okay, so we need to build up levels of empathy. So we need to, first of all, we need to explore, we need to understand, and then we can start to act. I'm just going to mute everybody for the time being, by the way, just in case. And feel free, if you've got any questions, normally when I mute everyone mutes, but it's not having any of it. So let's just do it. I'll just do it that way. There we go. We've done it. Okay. Yeah. Feel free to jump in if you've got any questions. Just I've made it so you can switch your own microphones back on, or you can put something in the chat if you want to ask any questions. So we're going to look at explore, understand, and act later on. So first of all, let's start looking at active listening skills now. Here we go. Rightio. So first of all, we're going to look at these 5 categories, counselling skills. We're going to look at attending behaviour. We're going to look at closed and open-ended questions. Also familiar to you, I would imagine, Deborah. You've probably done loads of it. Paraphrasing. Paraphrasing is important. Summarising is important. These are all important for different reasons. And reflection. So these are what we will call active listening skills. We're actively participating in the listening process. And we're showing the clients that we're actively participating as well. One of my beefs, if you like, with level 3 counselling skills is they overdo this, they overcook it. You have people sitting there and they're like nodding dogs. They're going, what I hear you saying is this, what I hear you saying is that, what I hear, and people don't act like that in real life. It becomes comical when you've been an experienced counsellor for a long time to watch that going on. So what I would like you to bear in mind is please don't become a nodding dog. If you've got rapport with the person, you'll naturally fall into a lot of these behaviours. And we want to be natural. Authenticity is the biggest part of a counsellor's, the most important part of a counsellor, really. People won't relate to you if you're not authentic. Okay, so let us go. Attendant behaviour, first of all. Right. So here are some pointers of how we use attendant behaviour. Orienting oneself physically and psychologically. Okay, I'm not going to expand on a lot of these. One of the things I will do, when you say orienting oneself physically, quite often don't have the chairs directly facing each other. Slightly offset is normally better. It can be quite intimidating if you've got chairs directly facing each other. Okay, and slightly offset. It sort of relaxes the atmosphere there, okay? So encourage the other person to talk. Okay, when you do assignments, I've got to see you talking, unfortunately. But when you first start doing clients, you'll find out that for 70, 80%, if they're good clients, For 70-80% of the sessions, they'll do the talking. That's what you want. So you want to encourage them to talk, and there's ways that we can encourage them to talk, especially with open-ended questions. Okay, so far, nice and simple. It is an easy, it's an easy morning really, this one for you, but it will give you the skills. So let the client know you're listening. Okay, one thing that really annoys me when I talk to somebody, if they're going like that all the time, I don't know about and see, these sometimes encourage you to do that, but you wouldn't do it in real life circumstances. You wouldn't do it. So now and again, you know, a nod of the head, do it naturally. Just give an indication that you're looking. The best way to indicate that you're actually listening is eye contact. But then we've got to be careful not to overdo that, because a lot of people, when you stare them in the eyes for long times, that can become intimidating as well. So do it naturally. I always have good eye contact with people I speak to in general, because I know how important it is, but I relax that at times so it doesn't intimidate them, so to speak. And we were saying here, let client know you're listening. So we're going to look at ways you can do that here now. And convey empathy. Okay. Empathy is, when they say convey empathy, empathy is really understanding another person's point of view from an emotional standpoint. Okay. The emphasis here is on emotional standpoint. Obviously psychological as well, but from an emotional standpoint. And you want to convey that. So how are you going to convey that you're understanding them from their perspective? Anybody want to hazard a guess at that? No. It's a simple process, really. There's a number of ways we can summarize, but mainly paraphrasing, which we'll come to. So if you told me something, I would say maybe, so what I hear you saying here is, and then I would say back in my own words what you've just told me, but the emphasis would be on my own words. That shows them I'm listening, but don't keep doing it. This is why I like to do these sessions, even for level 3 people, because I know I done level 3 myself, and they overemphasize it. And then what you get is people saying, so what I hear you saying here, and they're paraphrasing every 2 minutes, which breaks the flow of the conversation. The most important thing that we need initially in a counselling session is to listen to the client. We need to build up a picture of their world. We need to build up our own internal representation of their world. And the best way we can do that is them talking. Yeah. So don't feel like you're not doing anything when you're sitting there for 45 minutes of the first hour session. That's good. It's a good pointer. Okay. Lovely. Great. So here's some attendant behaviours, things that you can do. It says here, face the other squarely. I definitely wouldn't do that. I didn't invent shoveler. We've always been trained to offset them slightly. So I leave some of these on because it's up to you ultimately, but I would say just offset the chairs slightly. Head nods are a good thing. We do that naturally normally when we're talking to somebody. That makes them know we're listening. You know, that proves to them that we're listening. Adopt an open posture. Now, again, I'm not a great lover of this. If you've got your legs crossed, if you've got your arms crossed, you'd be in defensive. I often sit with my arms like that because I'm really, really comfortable. You know, but what they do say is adopt an open posture. So what they're basically saying here is don't cross your arms, don't cross your legs, because it can come across as being a bit embryonic, you know, cutting yourself off, insulating yourself. So an open posture, okay? Be welcoming, in other words. Right, this is an acronym, as you can see, of shoveler, the word shoveler. Okay, so verbal following, we can do this by paraphrasing. And paraphrasing is the main way we do verbal following. Okay, speech, okay, I think you just put that in just to make the shoveler word somehow, because it's quite obvious you're going to need speech. Leaning in towards the other person, that can make it a little bit more intimate at times. But bear in mind as well, is some people don't like you to invade their territory. So this is all open to interpretation. They're just some pointers. My advice is just be yourself. Okay, learn how to paraphrase and summarize, and be yourself. Okay. Eye contact is obviously important. There's nothing more frustrating than me for people when I go out and they, with friends, they talk to you, they make eye contact with you, and immediately you start talking, their eyes are wandering all over the place. It just simply means they're not interested. Really sort of ego-based, self-centeredness. So what we need to do is make sure that we make eye contact. Eye contact is really important. Okay, I would say relax it now and again, just so it doesn't become intimidating. I've tried all of these out in various ways with various groups to see how they feel, and just tested my theories on them that I've developed over the years. And one of them now and again is just to slightly relax my gaze so that I'm not staring at them. It's something that will come very naturally to you. Okay. As much as possible, be very relaxed. The more you relax, the more information you can take in. When you're not relaxed, obviously you're going to relay that to the client, which is going to make them feel uncomfortable. Yeah. And also, you won't be able, if you're stressed out or you're on edge, you're not going to be able to assimilate the information you need to. So learn to become relaxed. One thing I never do, especially with hypnotherapy, I have done it with counselling, is turn up last minute and run into the room. I always try and get there and relax myself first. Yeah. Is that okay? Nice and simple? Good. Right. So just give me a minute. Just going to switch this fire off. Getting a bit like an oven in here now. Right, so the next part is open-ended questions. These are important. These are one of your main tools that you will use to open up a client, to explore. When we talked about the first dates being explorative, I can't say that this time in the morning, to explore the client's world, one of the main features you're going to use, one of the main tools you're going to use is going to be open-ended questions. Okay? So an open-ended question would be something like, how are you today? Can you tell me a little bit about your childhood? Okay, it doesn't warrant a yes or no. It's not binary. It doesn't warrant a yes or no answer. Okay, it gives your client license to elaborate. And that's what you need to do to elicit more information. Yeah? Everybody all right with that? If you now and again, you give a little nod or something, or just a thumbs up so I know everybody is with me, that'd be fine. Cheers. So tell me about, here's some open-ended questions. Questions that clients cannot easily answer with yes or no, or one or two word responses. So it's about elaboration. It's our method of eliciting information from the client. Okay. Tell me about your family while you were growing up. There you go. Why is it important to you? How did you feel when that happened? And so on. They're ideas. They're all ideas of open-ended questions. And like I say, that's one of the main tools you will use to elicit information of your clients. Everybody all right with that? Nice and simple? Yeah. Like I say, it's very simple stuff. It's really simple stuff. Okay. Here's the purposes of open-ended questions. Sometimes to begin an interview or to begin a session, to encourage client elaboration, that's the big one. To elicit specific examples and to motivate clients to communicate. Okay. The worst scenario is the quiet client. Okay. Because counsellors cannot work unless a client gives them information. Okay, so, I mean, there is times when a client has given me hardly anything that I have to say that the counselling process is really dependent on their input. And I'm feeling perhaps there's stuff that they don't want to, they're not ready to disclose at the moment. And there's not enough information forthcoming for me to work with. So I'll be very honest about that. And if I do feel that, sometimes I will end the session the following week. You never end the sessions abruptly, say we can't go on like this and bye-bye. But the following week, if they agree with that, I would say something like, look, the door is permanently open. I can see perhaps that you're not ready to deal with some things and disclose some things at the moment, but you can come back at any time. So they're things that I do. So we all right? Open-ended questions, nice and easy. Yeah, just there for elaboration. Lovely. Closed questions. Okay, so these do warrant the answer of yes or no. Okay. Questions that the other can easily answer with a yes, no, or one or two word question. Did you drink before you got in the car? Okay, the purpose mainly of, I don't use a lot of close-ended questions in counselling, but the purpose might be to hone in on specific areas. With an open-ended question, it's quite diffuse. They can take you to where they want to go, basically. But if you want some information on a specific subject or topic that that we're discussing at the time, then you might choose to use one or two closed questions to elicit more information. That okay? All good? Yeah. Purposes of closed-ended questions: to obtain specific information, to identify parameters of a problem or issue. Okay. Are you taking medication at the moment for that? Yes. If so, what type? To narrow the topic of discussion, which I was saying before, to hone in on certain aspects of the topic you're discussing. To interrupt an over-talkative client. Okay. I try not to do that at times, but if I'm going to interrupt eventually, I normally do it in quite a joking way, actually. If I've got rapport with the person, I'd say it's my turn now, let's just look at this. So I'd sooner do it much more naturally, quite frankly. But very rarely do you get an over-talkative client. One thing you may get, and it can be quite overwhelming, is that when they first come, they will blast out many issues. And we look at what to do when we come to summarise, and we look at what to do with that. Okay, because sometimes I literally do. I go, whoa, let's just hold it there. They may have told me about 5 issues within 10, 15 minutes. And then I'll summarise the issues. I'll show you, we'll lead on to that when we come to summary. Okay, so here's some examples, of open-ended questions and closed questions. Are you scared? Closed question. You'll see, I used to have people guessing this, then I realised that I'd put a C or an O on the left-hand side of the screen just there and give them the answer, because everybody used to get it right. Wasn't very clever of me, I do agree. Right. So how do you feel? That's an open-ended question. Are you concerned about what you will do if the test results are positive? Yes. So that one is a closed question. Yes, no. That could elaborate. Obviously, that could elicit a different answer than yes or no, but it's probably got to be quite paired, the answer. It's probably going to be quite short. Open question. What do you think you might do if the test results are positive? Okay. This is bringing back memories of 3 weeks ago to me. And Monday, I've got a big day, actually. On Monday, I've got to find out whether I'm high risk, which will make a big difference. So these questions are on my mind at the moment. Is your relationship with your husband a good one? That's a yes or no. Yeah. Paul's nodding there. Okay. Tell me about your relationship with your husband. Open question. Like I say, there's no rocket science in this at all. It's just things you need to know. We need to give you a basic grounding in counselling skills, and you're probably seeing why we don't do a year of it now. You know, a lot of people will do this for a year. Um, in that year, in all fairness, they will give you a synopsis of the therapeutic modalities as well, and also professional and organisational issues, which we'll cover next time. So now we're looking at paraphrasing. This is one of the most important aspects, I believe, of counselling, of counselling skills, sorry. Okay. The counsellor rephrases the content of the client's message. For example, the client says, I know it doesn't help my depression to sit around or stay in bed all day. And the counsellor might say, it sounds like you know you should avoid staying in bed or sitting around all day to help your depression. Okay, so that would be a paraphrase. Yeah, and the only reason really, well, there's two reasons. We can clarify, we can test whether our interpretation is correct. Often we add a tagline to that. So I might say, it sounds like you know you should avoid staying in bed or sitting around all day to help your depression. Is that right? Okay, it's very easy on that one, but it's not always as plain and simple as that. So sometimes add that important tagline. Is that correct? I'm checking out my interpretations right. Okay, but I'm also, every time I paraphrase, the client's going to be thinking, this person's listening to me. You know, he's not looking out the window, whatever. He's actually absorbing all this. And he'll do that unconsciously, or she'll do that unconsciously, obviously. Yeah? We all right with that? Nice and simple it is. Okay, purposes of paraphrasing, to convey that you are understanding him or her, the client. Yeah? Help the client by simplifying, focusing, and crystallizing what they're saying. So often they may take 10 minutes and give you quite a convoluted version of the experiences they're having at the moment. Yeah? And you might sum that up in 2 lines, which makes it a lot easier for them. That's what we mean by crystallizing, focusing. Okay, so there we go. May encourage the client to elaborate. Obviously, if they say, is that correct? Tagline, they might elaborate on that. Then it becomes like an open-ended question to them. There's overlap between these things as well. There's especially summarising and paraphrasing and reflection and whatever. Right, you can also provide a check on the accuracy of your perceptions. That's what, I should have put it on there actually, with your tagline. Okay, is that correct? Yeah, good. So when do we use it? When you have a hypothesis, when you have a hypothesis. I think I'm going to go back to bed. When you have a hypothesis about what's going on with the client, okay? When you have a hypothesis about what's going on with the client. When the client is in decision-making conflict, yeah? Okay, so you're clarifying, crystallizing, and helping the client, basically, to clarify. When the client has presented a lot of material and you feel confused, summarising is good for that, by the way. Summarising is better for that than paraphrasing. Okay. Leah.
Hello, sorry to interrupt.
Yeah, it's all right. No, that's what we're for.
I was just wondering if paraphrasing as well sometimes can maybe help a client to hear their own words and to see things from a different perspective.
That's exactly what it's for, really. It's in a sense, it's mirroring, but like you say, to see things from a different perspective as well. Yeah, all of these counselling skills, paraphrasing, reflection, summarising, all have that element, Leah. Yeah? Be good with that?
Yeah, thank you.
Thank you. Rightio. Let's move on. Steps in paraphrasing. Client. A 40-year-old woman. How can I tell my husband I want a divorce? He'll think I'm crazy. I guess I'm just afraid to tell him. So steps. These steps just break it down and analyse what's going on. But really, I feel that's a bit too much. You know, it's plain and simple, but we'll look at them anyway. So first of all, what are you doing inside? You're recalling the message and restating it internally, okay? So you're internalizing the information and start to analyze it. If you had to do this consciously, you would never be able to concentrate on the client, quite frankly. So don't, don't buy into it. Just have a look at this stuff and paraphrase. It's very simple. Your unconscious mind will do all this for you. Identify, now this is important, identify the content part of the message, because sometimes 80% of what a person tells you is peripheral information that you don't really need, okay? And we're looking for the content, which in this case, the important phraseology is she wants a divorce, but she's maybe frightened to tell her husband, yeah? Yeah, or she thinks he's crazy. So that's the content. That's the important part of the message, really. Like I say, some people will convolute it. Some people will, it will go on for quite a long time. But what you need to do is determine what is the real message here. Again, it's not rocket science. Select an appropriate beginning. Okay, for example, it sounds like, or you think, or I hear you saying. Okay. Use what comes naturally to you, though. This authenticity, I can't emphasize, enough about authenticity. And a lot of people try to fit into these scenarios, like, I hear you saying this, I hear you saying it. And it's really like they're going out the way to say, I hear you saying this all the time. And it just doesn't come across that naturally, so I'd say things, so, what you're saying here is blah, 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 blah. Is that correct? Just the way I would do with my mate, really. There's no difference. In fact, you have real good rapport normally with friends. So the way you communicate with friends rapport-wise is a good example for you to use. Okay. Obviously, there's a lot of boundaries you cross with friends, which would be a no-no in counselling. So now translate the key content into your own words. So we want a divorce equals break off, split. It sounds like you haven't found a way to tell your husband you want to end the relationship because of his possible reaction. Tagline, is that correct? Yeah? All good? Lovely. Right. Now we're going into summarising. Okay. Let me just, let's cover the slide, and then I will give you some of my own interpretations of this. So why would you summarize? A collection of two or more a summary is a collection of two or more paraphrases or reflections that condenses the client's messages or the session. It can be used to cover more material, and it covers a longer period of client's discussion. So in times that you would often do summaries would be at the end of a session, halfway through a session to pull strands together, to pull different themes together, at the beginning of a session when you're summarising what you've done so far in previous weeks. Yeah. So this is why it's saying can cover a longer period, can cover more materials. Okay. One of the times I often use it, I said before, is when I become overwhelmed. So a client comes in, maybe one week, they say, oh, this week, I've lost my job, I'm splitting up with my husband, the dog's died, this has happened, that's happened. At that point, I'll normally go, well, can we just settle down here? And I'll say, I can see that you've got 4 or 5 major issues here. You've lost your job. You're having problems with your relationship. Your dog's not well. What's the most important one of them to speak about? Because I don't want to be, one thing you don't want as a counsellor is to be overwhelmed. And it's very easy when clients have got so much to get out. They want that cathartic release to bombard you. Don't let them make you feel overwhelmed. Summarise at that point. Let them get it out, take it in, and then summarise it. And then, in a sense, when you've summarised it, ask them what the most important issue they should be working on is. Is that okay? All good? So purposes of a summary: to tie multiple elements of a client's message, okay? To identify a common theme or pattern. So often, you know, you could have, they're having problems at work, they're having problems in the relationship, they're having problems with friends, and, you know, there might be the common theme of rejection, abandonment. So sometimes you want to look at all of these different strands. The example I've just given would make it quite obvious. It's not always that obvious, so sometimes we need to work at that. But it's ideal for pulling themes together. Sometimes themes that seem somewhat disconnected have a central theme running through them. In fact, nearly always that happens. Okay, so I always say that counsellors need to be like private investigators in one way as well. You know, we're there, we're probing with our open-ended and closed-ended questions. We're probing and exploring the client's psyche, and we need to be sharp. The theory, the therapeutic modalities theory, will sharpen your mind as to that's where I go. I love it, you know. I really, that's part of this, of the counselling process. I love, because once you digest the knowledge, especially of this course that you're doing, because we're doing about 15 therapeutic modalities, it's like light bulbs are going on all the time. I need to go there, I need to go there. Very rarely, you know, will you hit a brick wall. You may do in the early days, you know, that's feasible and that's normal. And that's why you've got supervision. Nick will be doing your supervision for you, but I'm always around normally as well to help out. There's two types of supervision. If you hit brick walls, one, it's because you're getting blocked, issues are coming up for you. That's personal supervision you need. And then there's case study supervision. So if you don't know which direction to go within a client, ask your supervisor. Yeah. To interrupt excessive rambling. Okay, if a client does ramble and let's say it's quite diffuse, let's say it's a lot of peripheral information that we perhaps don't need, then by all means interrupt the client. Okay, do this with care, but you can interrupt the client. Obviously, to start a session, we said that before, that it's quite important to actually summarising at the start of a session. You always think of a summary as something that happens at the end, but you're summarising previous sessions. Yeah. To end the session, you always summarise. Now, the other thing at the end of a session, you've got to bear in mind there's a lot of clients that have abandonment and rejection issues. If I'm here and I'm looking at the clock on the wall and it's now coming up to 25 to 11 and I've got my clients here and I say, oh, blimey, shit, you know, we've run out of time, I'll see you next week. That's not good enough, okay? A counsellor should always have a clock in their eye line, okay? And you shouldn't be looking at like that. Behind the clients, mine's on the wall over there. I can see it very clearly, okay? And 10 minutes before the end of every session, you should be saying to the client, right, I'm just noticing we now have 10 minutes left of this session. Then you start your summary, okay? So that you don't end the session abruptly and let the client go out feeling rejected. Yeah, that's very, very important. If you start to hear some little clatters in the background, it's starting to rain quite heavy here and I'm in the conservatory, so that might be background noise at times. Okay, so to end the session, make sure that you give the 10-minute warning. This is all, I asked Nick to give you out a session template the other week. It's on the website, you can download it. And what you're working on them after Christmas, you see. I'll talk more about that possibly at the end today. To pace a session also. Okay, if a session is perhaps going too quickly, I would say, and you want to pace it, you want to hone in on specific areas, and you want to pace it, you want to slow it down, you want to investigate specific areas more thoroughly, then you could use summary. Everybody all right with that? Yeah, lovely stuff. To review progress, obviously. When you do a review progress, please do ego stroking. Give them praise for what they've done. Okay, don't do it in a condescending way. You know, don't make it cheesy, but give them praise, because praise tends to motivate. So when you do review progress, always praise them. You know, say, I can see. And if they haven't made progress in certain areas, you can often reframe that. And, you know, well, we'll look at specific examples of that another time. I don't want to go too far off piece this time. To serve as a transition when changing topics. So we might say, well, okay, you're presenting problem. You presented today that you feel that you're suffering from depression. We've elicited that you know, this depression is keeping you quite insular. It's keeping you in the house, and you've got no interest in the things you normally do. And I might go on like that for 10 minutes. I would say, would you mind now if we go back and have a look at your childhood? Okay. So I do a summary, okay, and then a change tact. We go back to childhood. And what I'm doing when I go back to childhood, specifically with depression is nearly always repressed anger. I'm looking for examples, basically, and incidents in life where there's been a lot of repressed anger. So that's why I'm doing that at that point. That's another question. And I find this absolutely ridiculous. We get a lot of people who come from level 3, and I would sort of say, a counsellor doesn't ask why. Okay? Yeah? We've just got a dog on screen. Hi, Sharon. Sharon, can I ask you, if you're going to have the dog on your knee, could you put your camera off, please? Yeah, it's only, it can distract other people, you see. That's the only reason. Okay. Thanks a lot. I love dogs, incidentally. It's not about that, but quite often we get about 4 or 5 people with dogs on the legs of these, and it distracts other people. So I do love them, and it looks good.
He just jumped up, but I pushed him back down. He's on my lap now. It's okay.
Ah, that's good. Thanks, Sharon. Okie dokie. So, where were we? We were just, I forgot where we were then. Not to worry. Anyway, summarising, change and tact. Okay. If we want to change tact, if we want to go into a different area of a person's life, we might summarise that part of the session. Okay. So here's some steps in a summary. This example is taking that of a client of a 10-year-old girl. Okay. Or the client is a 10-year-old girl, sorry. At the beginning of the session, I don't understand why my parents can't live together anymore. I'm not blaming anybody, but it just feels very confusing to me. And it's said in a low, soft voice with moist eyes. Okay. Near the middle of the same session, I wish they could keep it together. I guess I feel they can't because they fight about me so much. Maybe I'm the reason they don't want to live together anymore. Can you see the key content there, right? Well, it's jumping at you. She's blaming herself, isn't she? This is where we should switch on, okay? A lot of the other stuff can be peripheral, but when we're looking for key content, it's that we're looking at. We don't have to remember the rest of it, okay? So here's the steps in the summary as well. Recall the key content and affect messages, or effective tone of the messages. The key content here wants parents to stay together. The key effect here is she feels sad, upset, responsible. Again, very simple really. Identify the patterns or themes. She is the one who's responsible for the parents' breakup. That's a big one, and it's a common one as well. Okay. Use an appropriate sentence stem and verbalize the summarization response. That's a lot of big words, really. It's just this. For example, I sense, or you are feeling that you're responsible, for your parents' breakup. So here's a summary. Earlier today, you indicated you didn't feel like blaming anyone for what's happening to your parents. See how they picked up on the key content. And that's where you need to be quite astute. That's very, very important. In earlier sentences, she doesn't blame anybody, but she was blaming somebody, wasn't she? She was blaming herself. Okay. Now I'm sensing that you're feeling like you are responsible for the breakup. Is that correct? Yeah? All right with that? Lovely. Assess the effectiveness of your summarization. You'll do that. The effectiveness of the summarization is going to be subjective and contextual, and that's going to happen in the session. So see what sort of a response your summary elicits. Yeah? So I'm going to do this as a class. I'm not going to put you into breakout rooms today. There's no point. It takes too much time, and these are very simple. So we'll go through these together, practical exercises. A 30-year-old man who has been blaming himself for his wife's unhappiness. I really feel guilty about marrying him in the first place. It wasn't really love. It was just a convenient thing to do. I feel like I've messed up her life really badly. I also feel obliged to her, and it's been said in a low, soft voice with lowered tones. Yeah. So it's scenario 2. Okay. A 27-year-old woman who has continually focused on her relationship with men and their needs for excitement and stability. In the first session, I've been dating lots and lots of men for the last few years. Most of them have been married. That's because there are no demands on me. Bright eyes, facial animation, high-pitched voice. In the fourth session, it doesn't feel so good anymore. It's not so much fun. Now I guess I'm having some commitment and stability in my life. Again, said with a soft voice and lowered eyes. Right. So here's 2 very, very simple, succinct, and a good counsellor will be excellent at this, be able to sum up. It's like essay writing. Some people, you've got 2,000 words, and some people could probably cut their word count down by 1,000 if they cut out the peripheral information that doesn't say anything. Yeah. And it's the same when we're doing the summary type things. What we're looking to do is cut out peripheral information and identify the key content and the effective tone messages of the important content of their responses. So in scenario 1, so you're feeling remorseful as you married convenience rather than love and you regret it now. Is that correct? Yeah? Scenario 2. In the beginning, you enjoyed dating married men because there were no commitments. However, that's not enough. You want more. You want more commitments. Is that right? Yeah. So again, no rocket science here at all, but really important things that you must be able to master. Okay. The difference between reflection and summarising and paraphrasing really is that the emphasis here is more on how they're feeling rather than the psychological content. It's still difficult to distinguish really. And like I said before, there's a lot of overlap between paraphrasing, reflection and summarising. Okay, so it's a verbal response to client emotion. That's the difference with reflection. Yeah. Here's another example. Incidentally, I'm going to play you some videos later on of me doing this in a session. But as I discussed in class on Thursday night, I will often elaborate from a psychological point of view when I'm doing a demonstration. So it won't be thoroughly natural the way I do it. I'm doing it for demonstrative purposes, so I'll inject education into it as well. Okay. So many things are going on right now. Another hectic semester has started. My dog's sick and my mum's ill too. I find myself running around trying to take care of everything. I'm not sure I can take it anymore. So the counsellor just simply identifies the content and the effective tone and says, So right now you're feeling pretty overwhelmed by all things that are going on. Simple, yeah. That shows the client you're listening, okay? It shows the client that you're understanding them from an emotional point of view, which really is the definition of empathy. And empathy is very, very important. Okay? So what is the purpose of reflection? It means that the client is feeling understood from an emotional perspective. Okay, there's rapport in there, you know. It will express more feelings. It will help the client to express, to elaborate on how they're feeling. Okay, it will do wonders for rapport. It will help the client to identify and manage the feelings, which is not always clear. Okay, we take it for granted, we know what we're feeling, but often when it's convoluted, it's not so easy, and sometimes it's easy to label what we're feeling, to identify what we're feeling, okay, and to discriminate among various feelings. Okay, any questions on that so far? Nice and simple. So we've got summarising to pull different themes together, okay. If you're feeling overwhelmed, you may want to, sometimes you can identify a common theme from many different strands of the counselling sessions, summarise at the beginning of a session, summarise at the end of a session, summarise whenever you want throughout the session. But summary obviously is for them reasons I've just given. Paraphrasing is about allowing the client to know that you're listening. So you're just literally repeating back in your own words what they're saying. That will give you a chance to assimilate the information, and you'll start to analyze it internally as well then. Okay, reflection is slightly different tact. Reflection is about emotional content mainly. Okay, on reflection, you hear people say that on reflection, and they're not necessarily referring to emotive experiences. And that's why I say there is some overlap. We don't have to be clinical on this. Just get an idea of what to do. So steps of a reflection. Client, a 50-year-old steelworker now laid off. Now look, what can I do? I've been laid off over a year. I've got no money, no job, and a family to take care of. It's also clear to me that my mind and skills are just wasting away. And they've said that. I didn't actually. I should put that at the beginning. Said it in a loud and critical voice. Obviously, this man is probably feeling quite insecure about the future. That often masquerades as anger. Okay? So steps in the reflection. Listen closely and observe the behaviour. Watch non-verbal behaviour. The signs of aggravation and whatever, tenseness. Verbally reflect the feelings back to the client. Okay. Take cover if they're too mad as well, under your desk mainly. Identify the feeling category. Okay. So what is it exactly that they are feeling here? And nearly, or most feeling, arises from insecurity, or a lot of it's to do with pain. A lot of feeling, but identify the feeling category. Okay? Identify the intensity of that pain. In other words, is it going to block us to continue without having some sort of cathartic release here? Because one thing you don't want to do, a lot of people say when somebody's mad, basically calm them down, don't they? And yes, that is important in one sense, but if we try to calm somebody down in a counselling session that is not ready to be calmed down, okay, they're going to think we haven't got a clue, we've got no rapport with them whatsoever. So I encourage you, I can say, we see you're angry, should we get this anger out? See you're frustrated. Should we start and let who are you angry at? If I was that person, if they were angry at a specific person, I'd use Gestalt. I'd say, let's pretend I'm that person. Let me have it. I'm not going to take this personally. So they might let the frustration out on there. what I've done then, basically, I've let them express their they've had an emotional cathartic release, in a sense. Then that stops the blockage and I can carry on with the counselling session. Most important. I think you're going to cover Gestalting after the half term with Nick. So that'll be good. We'll revisit these. We've got loads of time. We're doing very well with the curriculum. Okay. So sometimes, especially in NLP, they say about matching and mixing the intensity of the word. So sometimes when we've got rapport, we might bring our tonality up and our emotion so that we answer them. So I can say, I can see you really angry here. I can feel that anger. And it's as though really there's a transference onto me. But what I'm saying to them is that I really understand this from your point of view. So it's not always about calming them down. In fact, quite often it's not about calming them down. Obviously, if they're raging and they're throwing your lamps around in your office and whatever, well, that's unacceptable. But if they're just mad, our objective really at that point is to allow them to have their moments of madness, of anger, or whatever it is. It's authenticity. Okay, but what we need to do is pace and lead. So what we might do is allow them time to get, to have this cathartic release, and then we lead them back into a calmer space. Okay, we can do that with our voice. There's many ways we can do that, but it wouldn't be appropriate initially. Like I say, they think we haven't got a clue what they're talking about if we just dismissed what was troubling them. So matching feedback to the client. Okay, I can see you're really angry today. You want to tell me more? But before we even start, before we even look at what we done last week, let's get this anger. Let's have a look at this anger. What is it? What's troubling you? If it's conscious, they'll be able to tell you, which was the point I was making before. Lots of people come. I've had this, especially from a lot of them from the University of Manchester that I have. You can't ask a why question. You're not allowed to ask a why question. They have these rules that are absolutely appalling. I don't know. I say, give me a logical reason why I should not ask a why question. And my first answer is that if the answer is unconscious, they're not going to be able to respond to it. That makes sense. But I could explore with open-ended questions a topic for 20 minutes with a client, and they know the answer to it, which would have taken me 30 seconds to elicit the information instead of 20 minutes of open-ended questions. So in answer to, does a counsellor use why questions, I'm going to tell you, yes, we do. And I don't care what all the other literature tells me, that we don't use it. And I've never had anybody, including people with doctorates, MScs, give me a good enough reason not to use a why question. The main problem with using why questions is most of the time the client doesn't know the answer to them. But if you feel it's appropriate, why not try a why answer, drop one in there. If you get the answer you're looking for, great. You've saved your client 20 minutes. You've saved you 20 minutes. Don't become, one thing I will not train, and I've had a lot of experience in this over many decades now, is that I will not train robots. And that's, nowadays, counselling training is becoming like a conveyor line of these people who are all sort of like AI figures, it's all very, very methodical and programmed. Please, the commodity you are selling to a client is you, okay? And your personality, your subjectiveness, what you have to offer, your authenticity, that's what clients will buy into. So please do not become one of these nod and dod, artificial, intelligent type conveyor belt counsellors that they're churning out all the time now. And when you go for your placements and people are going on about, degrees in master's degrees, don't feel inferior. If anything, feel superior, because most of them come to us because they don't understand how to work with counselling. I guarantee you that. And I can put you in touch with so many people with MSCs that have come to us. Because they don't understand counselling. It's too theoretical for them. They've been trained in this this way. So be yourself. This teaching, what I'm doing now, is more important than anything. Including all of this that I've got up on the PowerPoint, this is more important than anything. Authenticity. Okay, so, right. So it steps in a reflection. Listen closely and observe behaviour. Watch non-verbal behaviour. Verbally reflect the feelings back to the client. Identify the feeling category. Identify the intensity. Match the feeling and intensity of the word. Feed back to the client. Okay, we do that in feedback, as obviously that can be in forms of summary or paraphrasing. Add content using the form, you feel this way because of that. You know, so if you've got any thesis of what might be going on, do that, but check your accuracy. Always check your accuracy. That's most important. Is that correct? Yeah. Lovely. Example. My father told me I was adopted when I was 13. I went off my head for a while, rebellious, got in with the crowd, and my world turned upside down. Sounds like you were lost and confused. So that's a very, very simple, you know, and that won't interrupt the flow of conversation if that client wants to elaborate then, okay? On other times, that might seem a little too paired, you know, that the client wants you to elaborate. You can't really determine that unless you're in the room. So the client, yes, it took me ages to get my head straight. Actually, I haven't, still feel very distant from it all. So the counsellor, so there's a sense of things not being right for you, of misconnections. Client, part of the story I'm missing, large parts. I want to meet my natural parents, but I'm frightened, terrified they may not want to know me. Counsellor, so fear of the unknown and possible rejection. These are the things that cause you most anxiety. Is that correct? Yes. And this stops me doing anything. You see how we're getting into it? Yeah? Lovely. Right. Oh, let us just watch this. I'm looking at it's about an hour. Can we just have at the moment, can we just go and have a 5-minute screen break, okay, before I go into this video? Yeah? Just 5-minute screen break. So if we can get back here at 11, please, just a toilet screen break. Okie doke. Okay. Okay, everyone. Right, 5 past week, she'll continue now. There we go.
Good communication skills are essential for a positive interaction with the patient during the counseling session. Let's review the counseling skills used by the Contraceptive Choice Project and then watch as a counselor demonstrates each one with her patient. Close-ended questions are used to collect factual, non-sensitive information.
Maria, do you smoke cigarettes?
Yes.
And for how many years have you smoked?
Like 2 years.
And how many cigarettes either a day or a week do you smoke?
Just like 2 a day.
Open-ended questions are used to elicit feelings and detailed information.
What do you like about this method?
Well, I like that it's highly effective, it works for 10 years, and it doesn't have any hormones.
And how do you plan to protect yourself from sexually transmitted infections?
Well, my boyfriend and I use condoms regularly, and we get tested as well.
Probing questions are used to elicit more in-depth information.
Have you ever been told that you had high blood pressure?
One time, but I don't think it was anything serious.
Can you tell me a little bit more about that?
Yeah, one time I went to the doctor and he said it was a little high, so I went back for a few more checkups and it was fine then. Maybe I was just a bit stressed.
Okay.
To get the information you need to help a patient, you must listen actively. This technique involves communicating, without words, your interest in the needs the patient expresses. You can open up communication by using silence. You can let the patient know that you are listening by maintaining eye contact, leaning forward, occasionally saying words like yes, uh-huh, and please continue. These are signs of respect and generate a feeling of well-being in the person who is being heard.
What method of birth control do you think you might be interested in today?
I don't know. I used the patch before, but it irritated my skin a little bit. I did like knowing that I get my period every month. And I like the fact that my periods were shorter and lighter.
Okay, well, we'll definitely go over all of the different methods of birth control today and make sure that we answer any questions you have before you go.
Great. The next technique you can use in a counseling session involves repeating, synthesizing, or summarizing what the patient has told you. This helps the counselor clarify what the patient is saying and helps the patient feel that she's been heard.
So Maria, after hearing about all of your options, what method sounds like a good choice for you?
I don't know. I like the long-acting methods, but I'm not sure how I feel about irregular bleeding or not having a period at all.
So it sounds like you're interested in a method that's highly effective, but also a method that's going to allow you to have your normal monthly period.
Exactly. I think the copper IUD might be for me.
Okay.
This counseling technique involves clarifying the feelings the patient expresses in order to help understand her emotions. It is helpful to patients to let them know that their reactions to a situation are normal and that those feelings are common to other people in similar situations. You can communicate that the feelings are valid.
Is it safe not to have your period every month?
It's completely safe not to have your monthly period if you're using a method of birth control that has hormones.
I would be worried I was pregnant.
You know, and it's completely normal to feel this way. So it sounds like having a monthly period is important to you and you want a method of birth control that's going to allow for you to have that.
Yeah, I think I do.
Okay.
Before you give any information, it is helpful to ask questions to determine how much the patient already knows. It is important to provide information using words that the patient can understand. Ask the patient to repeat the information you have given her to verify that she understood.
Okay, Maria, so I talked to the clinician, and she does want to send you home with a pack of pills for the month and then bring you back for your IUD insertion once she can reliably rule out any chance of pregnancy. So are you familiar with how to use the pills?
I've taken them once a long time ago.
I want to make sure you leave today completely aware of how to use them. So we recommend the quick start method, which means that you're going to take your first pill today. You will need to use backup contraception such as condoms or not have sex for 7 days. So you may have some breakthrough bleeding. This is completely normal. Just continue taking the pills as directed. Take one pill every single day around the same time, and then when you reach this last row of pills, these are your inactive pills, so they contain no hormones. This is the week that you'll get your monthly period. For some reason, if you don't get your period this month, you may want to consider a urine pregnancy test at home, or we'll be bringing you back into the clinic for your IUD insertion, so we can always do a repeat pregnancy test here as well. Some women think it's helpful to set an alarm on their phone or to download an app to their smartphone to help them remember to take a pill every day. If you miss a pill, then you do need to take it as soon as you remember. If you're more than 24 hours late taking a pill, take 2 the next day and make sure you use backup contraception for 7 days. If you've had unprotected sex and you're more than 24 hours late taking a pill, you may want to consider emergency contraception. So do you have any questions about using the pill?
I don't think so.
Okay, so what's your plan?
Well, I'm going to take my first pill tonight at bedtime and make sure I take my pill every night around the same time. We're going to continue to use condoms, and if I miss a pill, I'm just going to double up the next day.
Okay, great. You're set. So you can just give us a call if you have any questions, okay?
Great. Yeah, thanks.
Great. Thanks, Maria.
The next essential counseling skill we will talk about today is arriving at agreement. This involves clarifying and summarizing the decisions that a patient has made during the counseling session.
Okay, Maria, so I'm going to go present your information to the clinician. If she thinks it's appropriate, then she'll insert your copper IUD today. However, if she's not comfortable inserting it today, then we'll send you home with a bridge method for a month and then bring you back and do a repeat pregnancy test and then for the insertion. Does that sound good to you?
Sounds great.
Remember, sharing a reproductive health history and talking about contraception can be uncomfortable for some patients. Demonstrating effective interpersonal skills is essential to help the patient feel comfortable and respected during counseling.
Okay, so that's just really a very simple,
Good communication.
okay. That's just really a very simple description. It's in a slightly different context, in a clinic, but just gives you an idea really of how we can use these. What are the main skills we need to use? How we can apply them. You will get a better idea when I show you the video of me working towards the end of today. And we're doing very well, so it's not going to be a long day for you today. I am recording everything, so it won't be a long day. We're doing really well. So the next subject, this one is really important. How many people here, and how many people, when you experience silences, when you're out with a friend, how many of you have a tendency to feel uncomfortable and want to fill them as fast as possible? Yeah. Yeah, I was definitely like, I'll go with that. I'm not so much now, but I was like that, before I realised, about counselling skills. I would say, actually, the numbers there, maybe because you switched on and whatever, but the numbers there were very low. Normally, if I ask that question to a hall of people, if I'm doing a talk, most of them will put their hands up. Most people feel uncomfortable with silence. And we must become comfortable with it, okay, for these reasons. So we're going to look at now managing silence, okay? So effective listening involves silence. However, during silence, the counsellor needs to show the client that he or she is still with them. This can be done through your demeanour, body language. Silence can be a time in which the client gathers their thoughts, assimilates and processes information. It is an important part of effective communication. This is really important. It's not just the client who needs to assimilate information. It's not just the client that needs to internally analyze information and make sense of information. It's equally important, if not more important, to the counsellor. Okay, so during periods of silence, use periods of silence, one, to allow the client to gather their thoughts. It may be that they're feeling somewhat defensive and don't want to push on. It may be that they're trying to determine the correct phraseology to put over. It may be that they're thinking about scenarios and what's called a neuro-linguistic program, a transderivational search, where the mind goes off to retrieve information from the unconscious mind and brings it back up. So we want to really allow an honest silence. It's very, very important during counselling. Is that okay? I can't emphasise the importance of it. And I don't care. I didn't see many people put their hands up, but mark my words, I will guarantee a lot of you will be uncomfortable with silences. Yeah, you really will. Okay, but there's reasons for it. For a professional therapist, silence is important. I'm going to tell you what I do. I educate my clients because we're told that silences are good. And we know that as professionals, we know that. But our clients are still uncomfortable with silences. So what I do a sort of preamble, if you like, with my clients. Sometimes I say, look, when they first come, during these counselling sessions, there's going to be times of quietness, of non-talking, and that's times that we're trying to gather our thoughts and whatever. And lots of people can become uncomfortable with that. But when it happens within the counselling sessions, let's both honour it. Let's take a little bit of time out to gather our thoughts, and let's both feel comfortable with that. Is that okay? See what I mean? In a sense, I've made my client feel at ease with, because I feel at ease with silence now, because I know, the importance of it. But my client doesn't necessarily know. So for me, I give a little preamble. It might be something you want to do yourself. Yeah? Any questions? Oh, sorry, Paul, you've got your hand up, mate.
Yeah, it was just to say we worked with a young man one time, and we call it, he needed processing time.
Yes,
If you asked him a question, he needed time to process, and pretty much the minimum amount of time that he needed was about 10 seconds.
Yes, yeah.
Now, when you're in a normal conversation, the flow is normally just, there might be a second gap and then it bounces back. So it was actually an incredibly difficult thing to learn.
Yes.
To just don't ask another question, because if you added another question in the gap, you just doubled the sort of demand on him.
Exactly.
But it then doubled the amount of time that he needed to process the information, and but I still was, but, and then having to learn to kind of go, shut up and listen, and just let his head work out what he needed to say. Yeah.
Precisely, Paul. And there's one great example of why we do this. We can start to overwhelm the clients if they're processing, and which is is a really good word to use. Obviously, if they're processing information within that silence, and we're not comfortable with the silence, so we start to bombard them with more questions, then they're going to become overwhelmed, frustrated. Okay, good point, Paul. Well done, sir. Okay, right. Where did we get to? So, I'm not doing exercises in small groups. Not at this point. Probably the days we've got next year, I'm going to use actually for you to go into your breakout rooms and counsel each other remotely, because we may be able to inject some sort of other certificate for you then, saying that you've covered remote counselling. I do this often. And I'm also going to speak to you. I'm making some inquiries as well about, I've done it before, about those of you who haven't got level 3 certificates, because we're covering the curriculum and a lot more, about issuing them for you. But leave that one with me, okay? It's going to be my last classroom course, so we've got to have a look what we can do for you. Rightio. So this is exercise in small groups. I'll read this, but we're just discussing it really. Feelings about silence. What are your feelings about silence? Okay. Does prolonged silence make me feel uncomfortable? We've had this discussion already. When there is a lull in the conversation, are you tempted to fill in gaps? Yeah. I can answer yes 1,000 times to every one of them, and still can be like that when I'm out in public. Okay. With my normal hat on, without my counsellor's hat on. I often feel tempted to finish other people's sentences. I don't do that. That's one thing I don't do when I'm out. Okay, I used to, but I don't. I don't like it being done to me. It preempts saying, I don't like it at all. So it's one thing I don't do. Sometimes when I am silent and on my own, I can think more clearly. So that's a reframe, isn't it? That's the positive aspect of silence. We must relay to our clients that it's okay to dwell in some silence, to process stuff, to analyze stuff. I often feel tempted to finish other people. Sorry, yes, I've done that right. Silence is an essential aid to self-listening and to listening to others. It is. It's one of the most important active listening skills that we've got, silence, for reasons that have already been outlined. Okay? Lovely. We're doing very well anyway, time I. Right, again, here's another. I'm going to read these exercises out loud. If you want to come in, put your hand up or unmute yourself and jump in, okay? If you're happy, I'll move on. So discuss the feelings. It's similar to what we just said, really. These are things, if we were in a classroom, we would break off normally and discuss. But even in the classroom, I don't do that now. I just normally have a class, a group conversation about it, our class com. So feelings about silence. Prolonged silence makes me feel uncomfortable. Actually, that's a repetition of the last one by the looks of it. So I'll probably cut and paste it onto a different slide. So it's a repetition of the other one. So there we go. There's not much else to say about silence other than emphasize its importance. Yeah? That makes sense? We all happy? Great stuff. Lovely. So now what have we covered so far? Let's do a quick summarize, okay? Paraphrasing is basically repeating back to your client what you've just heard in your own phraseology, in your own words. Purpose of doing it is so that they know that you're listening intently. Okay. Summarizing, often used to put themes together. When there are a multitude of different themes in a counselling session, you're becoming overwhelmed, or issues, you can pull them together and you can ask the client, which do you feel is the most important? I can see you've got a number of different issues here. Which do you think is the most important? And then from that way, you can, in a sense, you can prioritize. Okay. You would do it at beginnings of sessions, whenever you want throughout the session. At the end of the session, remember the 10 minutes bell. Towards 10 minutes towards the end, give them a warning and then summarize. What you don't want really, you don't want to open new conversations at the end of a session. Okay. You don't want doorknob comments that warrant an elaborate answer. A doorknob comment being something that, oh, I've just forgot something. When they get to the door, just forgot something I should have told you. It waits till next week. They're boundaries. We must have real strong boundaries. You know, you don't go more than an hour. Most counsellors now work to a 55-minute hour or a 50-minute hour because they're starting new. So for that reason, you know, you may be starting new clients every hour, for instance. So you've only got a 10-minute window in between. So a lot of counsellors do what's called a 50-minute hour nowadays. Anyway, boundaries. You don't elaborate on doorknob comments. You say, that's fine. Let's leave that for next week. Boundaries must be pretty rigid. Okay. So we're going to, we've done reflection. Reflection, the emphasis is on the emotional content of what a client has told you. Yeah. Summarizing, bringing themes together, paraphrasing in your own words. Silence, often about processing, analysing, whatever. It's about really focusing our awareness in our internal world for a while. And I think Paul's probably brought the best word out for that. It's about processing, isn't it, mainly? Okay, right. So this is really important. I am, as a counsellor and as a person, I am very challenging in my approach, okay? I've learned to be over the years. I do like to move clients on where I can, but I understand the importance of pacing a client. I understand the importance of not compromising a client's defense mechanisms before they're ready to let them down. But if that goes on, if a client has got their defense mechanisms engaged and are not dropping them, then I do become quite challenging. In other words, I'm going to put challenges to my clients. And it's in the interest of the client as well. Always looking at what response I'm getting emotionally from them. Yeah? So let's have a look at challenging now, people. The aim of challenging as a skill is to encourage the client to look at other perspectives, accept the value of other perspectives, although they may not agree at first. They may find other perspectives painful, which is why you've always got, I can't express the importance of this enough, emphasize the importance of this enough. You must always take into consideration that a client's defense mechanisms are there for a bloody good reason. Okay? So honour them. But if they are rigid and you can't get past them, quite frankly, counselling's not working. So we do have to be a bit more challenging in order to chip away at defense mechanisms. Yeah? They may not want to leave the comfort of their own perspective. Okay? That's a big problem, really, because quite often when a person's got a rigid perspective on a circumstance or situation, they will filter out all of the supporting information that disputes it, and they'll only take on board the information that supports their perspective. And we need to be wide open to this, aware of it. Yeah? You know, so we need great awareness as counsellors. And mark my words, Recently, in recent years, the counsellors we're producing, honestly, they're all going on to work. It wasn't always like that, but most of them are going on to work in the field. They're so switched on nowadays. And I believe that's because we've progressed the course in accordance with what's been needed out there. So our job really, Nick and Nicola's, is to try and raise your awareness as much as possible as to what scenarios may be going on in a person's mind. That's why we use all the modelling. Okay. So, typical areas of challenge, discrepancies and contradictions. I see you laughing, but you know, this seems a painful subject. The laughing there obviously is a defense mechanism. It's very uncomfortable. You say, oh, it's got it next day, I didn't see that. You say you're sad, but you're smiling. Okay, so there's a discrepancy. Contradiction was given in that example before, wasn't it? You said nobody's to blame for, earlier on you said nobody's to blame for my parental breakup, but now you seem to be blaming yourself. There's a challenge and a contradiction. Okay. So ways of thinking. If you treat me badly, it means that I'm utterly and totally worthless. Okay. That is a cognitive distortion. If you put an equal sign, that's what I do and you talk to do in NLP. If you put an equal sign in between, if you treat me badly, okay, and then means that I'm utterly and totally worthless, them two don't add up, okay? Because being treated badly by one person doesn't mean you're totally and utterly worthless. It's a cognitive distortion that, okay? One does not equate to the other. If I'm late for work, I will lose my job. Again, if it makes it easy, put the equal sign and see does it add up. And it doesn't, does it? I've been late for work. I mean, I've worked for myself a long time, but I've been late for work on numerous occasions in the past, and not once was my job under threat. You know, so there for discrepancies and contradictions. So what if somebody said, you know, this person's treating me badly, therefore I am utterly and totally worthless. Okay, my head opens right up. As a therapist then, I think, okay, you've given me so much information. The first thing I'll point out is that I'll say, actually, if one person treats us bad, it doesn't mean we're totally and utterly worthless. Okay. Then, when Nick done cognitive behavioural therapy with you, did he do inference, core belief and expectation? Did he do that part of it at all? Not everybody does it, but what we could see here from a cognitive behavioural aspect is that if this person is treated badly by somebody, and we all get treated badly by people, and I don't think I'm totally and utterly worthless when I do, okay? They're making an inference on that experience. They're saying, if you treat me badly, okay, it means the inference here is I am totally and utterly worthless. That tells me as a therapist, they've got core beliefs, they've got issues in the past that are giving rise to low self-esteem. Do you see what I mean? There's a signpost there for me going, get back, have a look. So I remember this by the acronym ICE. Inference, there's an inference there, I. That inference is going to come from the core belief, and that core belief is basically I am worthless. Yeah? Yeah. And that will give rise to an expectation for the future. Okay? That could be a number of things, you know, that could manifest in so many different ways, you know, self-sabotage, unable to create meaningful relationships, not willing to approach people for jobs and whatever. You know, this worthlessness can manifest in myriad ways, really. Okay, so that's ICE, cognitive behavioural therapy. And what generally happens, people when something happens, when an experience happens like this, if they're treated badly, they will often make an inference, and that inference will be something like, I am totally and utterly worthless. That is an inclination that's coming from unconscious sources, okay? and it will be tied deeply into a core belief that's probably be formulated in their formative years, okay? So this gives you a total and utter big arena within to work, you know, within their psyche. For me, that opens up so much. And that will give an expectation. Again, the acronym ICE, I-C-E, inference, core belief, expectation. Yeah. Right. So let's have a look at another area of challenge, vagueness or apparent confusion. I was just making sure to turn the recorder on then. I have. I never seem to be able to figure anything out when it comes to my parents. I'm so confused about it all. Right? So there's a sort of vagueness and whatever there about that. So we may want to, I mean, that for me is not so much challenging, but it's trying to, what's the word I'm looking for? But to make things more apparent. So if a person is deliberately being vague, it's probably defensive, okay? And that's where you may issue a challenge. That's where you may want to say, I'm hearing these answers, but I'm feeling that they're quite defensive in nature because they're so vague. Is it that you are scared to answer these questions, or is it that you're perhaps unable to answer these questions, or is it just naturally you don't really know the answer? Is that why it's vague? I want to clarify. So that's a very gentle challenge in a way, isn't it? You know, you don't have to be abrupt with challenges. In fact, I would discourage that being abrupt, okay? So making something or someone else responsible for the problem, okay? That's called scapegoatism quite often, or shadow projection can be another way for that Jungian term, shadow projection, where often people, the ego doesn't like to own its own defects. So what it does, it sees them situated in other people and then blames them. And obviously a person can never grow if that's the case. So that's one manifestation of this. So making something or someone else responsible for the problem, a popular and effective way of owning and therefore having the power over our problems. Okay, so that's just another area that you may want to. If the locus of power is within us, then we can change things. If the locus of power is placed in another person, in other words, if we're blaming another person, we can't change other people. So really, what we're doing is we're disempowering ourselves. I love the serenity prayer, you know, which AA adopted, and I learned it in AA. But it's not AA. AA adopted it. And if you leave the God bit out of it, it's grant me the serenity to accept the things I can't change. I can't change other people. Okay. Give me the courage to change the things I can. Okay. Anything that is under my, within my psyche, I can change. Anything where the locus of power is internal to me, I can change. And the final one is have the wisdom to know the difference of that which you can change and that which you can't change. Very simple. I don't think anybody ever knew who was the author of that. I don't think it ever come to light. But so powerful words, which I use frequently. You know, we can't change other people, but we can change our relationship to other people. I do it frequently as I get older. I've changed it with lifelong friends that I don't see anymore because the relationship wasn't really working anymore. Friendly relationships wasn't, that can seem a little bit mercenary, I understand, but they just weren't. So, and I have power to do that. But years before that, what I was trying to do was change the person, and I can't do that. So it saves me a lot of headaches. So there we go. Let's read the exercise, but we're not going to do it. Maybe we'll have a discussion on it. Individually, think back to times that you have been challenged. Did you find it helpful? Think back to times you have been helped. Was challenge part of the procedure? For you, what is the difference between helpful challenge and unhelpful challenge? They're the things you can go away and have a think about. Yeah? They're just things we can contemplate. If it was in the classroom, I would break now, but I really don't want to put you into, today I don't want you to put you into breakout rooms. Okay. Oh, we're all right with challenging? Yeah. Okay. Let me just, we're all right. So we're going to now look at empathy. Yeah. The way I invoke empathy, the way I try to gain empathy with the clients is by asking the following questions. Give me a sense of what that feels like. Okay. Not how is that for you? Give me a sense of what that feels like. Because empathy primarily is emotionally biased. You know, it leans towards emotion. You'll hear it said, and it's not wrong really, you know, it's looking at a situation from somebody else's shoes, but that's not really an accurate description of empathy. It's so-so, it's a loose description. Empathy is the counsellor's ability to sense the client's world the way the client does and to convey that understanding. Okay, notice these are different definitions. Empathy is the skill of reflecting back to another person the emotions he or she is expressing so that he or she feels heard and understood. Yeah. I can see you feeling low at the moment. That's an empathic statement. The word empathy is actually a poor misleading translation of the word, whatever that says there. The current translation would be in feeling or feeling into something. Okay, so you can see that the root of it is from feeling. So empathy involves two major skills, perceiving and communication. Perceiving life from the other's perspective and communicating that back to them. Yeah? All good? Lovely. So Carl Rogers, Paul, yes?
It was just going to. I was just going to say that there's within autism and within the critical autism stuff that I teach and do. Yes. There's a phrase called the double empathy issue.
Yeah.
And it was written, but it's actually a friend of like Damien Milton, his name is, and what it effectively means, and it fits there really very, very well. Communication is a two-way process.
Yes.
Yeah, and what often happens within communication is that if somebody doesn't understand what's going on, it's their fault.
Yes, yeah.
Yeah, you see, when there's a power imbalance, it's like teacher and pupil.
Yeah,
I've explained it. You didn't get it. It's your fault. You didn't get it. Well, what if you were just really rubbish? I'm sorry that there's a load of noise in the background. The dogs are just going a bit bonkers.
That's all right, can't hear.
It is a double problem. It's a two-way problem.
Yes,
so if you actually go into that with that in mind, thinking, actually, did I explain myself particularly well?
You know,
did
I on that point,
I like that double empathy.
Yeah, in your linguistic program, it said much the same. It said the meaning of a conversation is how it's received, basically. And that might mean not that the other person's stupid, but that you're a bad communicator. And I think, you know, so there is an area there, isn't it, Paul, for both sides to look at each other. How is this in NLP to say, how is it being interpreted? My communication being interpreted, and I think that's similar to what you're saying, isn't it?
Yeah, I think that's it. Absolutely, it is a case of just keeping in the back of your mind that simply because you're explaining something doesn't mean that person will understand it.
Exactly.
And if you don't understand them, there's a good chance they don't understand you. So it's this double kind of thing. And not to put the blame all on one person for not understanding it.
As counsellors, if somebody doesn't understand what I'm saying, I want to be able to be very flexible in my communication methodology to be able to take a different tact as well. You know, and there's other things that might, you know, when we look again at NLP, we all think in different modalities, you know, and it might be that we're trying to explain something using auditory predicates. So I might be speaking in all sorts of, I hear what you're saying, this, that, and the other. And the other person might be very visual. So I'm using the wrong communication methods. I don't want to confuse people with that stuff at the moment. But there's so, I mean, I could talk for hours literally on it. But that's it's a great point, Paul. And thanks for your input, buddy. Thank you. Okay. So, in Carl Rogers, the therapist is sensing the feelings and personal meanings which the client is experiencing in each moment. When he can perceive these from the inside as they seem to the client, and when he can understand and when he can get something missing there, understanding to the client, then the third condition has been fulfilled. Okay. Rightio. So here's some questions to ask yourself. Can I step into a client's private world so completely that I lose all desire to evaluate and judge it? Now, I asked this question, and when I was at your point, and even now, I would answer no to that. I would absolutely answer no to that question if I was being very, very honest, because that takes a hell of a skill to do that. We're aiming towards perfection, and I think people who write these phrases haven't thought about this properly. You know, that is what we want to aim to be able to do. But we like the saying from Anna Nin, you know, that we were talking about. You know, we add ourselves to what we perceive. So you can't just say, oh yes, I'm going to switch myself off and I'm going to step into a client's world and I'll understand it thoroughly. Doesn't work like that. It takes skill. It takes experience. It takes practice. It takes being able to take your own personality, you know, that you're clad in. It means that you've got to put that to one side. That's not easy, believe me. That will come with time. So, you know, perception, to perceive things from a client's point of view, empathically, you know, it takes work normally. Can I let myself enter fully the world of the client's feelings and personal meanings and see these as he does or she does? Can I enter it so sensitively that I can move about it freely without trampling on meanings that are precious to the client? Can I sense it so accurately that I can catch not only the meanings of the client's experience, which are obvious to him, but those meanings which are also implicit? Okay, there's an awful lot of implicit knowledge and information in conversation. Okay, that's not, you know, it's not overtly obvious. So, which he sees dimly or as confusion. So some empathic comments. The empathic comment is the message the counsellor sends to the client that they have been heard and understood. So we take in the information, we try to understand the information given the context of the client's life as well. And Rogers wrote this: to be with another in this way, meaning empathetic, means that for the time being, you lay aside your own views and values in order to enter another's world without prejudice. In some ways, it means you lay aside yourself. Now, my argument to that is often you're not going to enter without prejudice. Somewhere. We've all got psychological propensities, you know, they don't go away overnight. What we need to be is aware of them, and we don't need them to influence. It's more important, we may not be able to eradicate them, that's difficult, but we need to be very aware of them, and we need not to allow them to interfere with the counselling process. That's more important, and that's more accessible. If you found that you've got issues or you're being triggered, or you feel uncomfortable with the client, you need to go to supervision right after that session or before the next one. Okay, that's the importance of supervision. Is that okay? So what I'm saying here, don't aim for perfection. You know, it's very difficult to put all of your psychological propensities to one side and just listen. If we could do that, wouldn't it be wonderful? You know, all my problems, all my issues, all my biases, let's just put them aside for one moment and move on. Life's not quite like that. The complicated human being is not quite like that. We need to have an awareness of them. Yeah, we need to become aware and not let them interfere with, you know, for instance, I mean, when we look at transference, if you find purpose in life being a motherly or fatherly type figure, and a client says, you know, comes across and let's say puts across their issues, okay, unconsciously you might have a propensity to want to put them in transactional analysis terms into child mode so you can mother or father them. And that gives you a sense of purpose. That is something you need to be very, very aware of. I've had a few of these scenarios, and I've been like that in my life at times, okay, because it boosted my self-esteem. You need to be very, very aware of that and step away from that. These are things that, you know, where awareness is. It doesn't necessarily mean you're going to take that motherly or paternal instinct away from your personality, because maybe that's what gives you a sense of purpose in life. It means that you're not going to utilize it in a counseling session, okay? So these are areas that you should really be able to heighten your awareness of, you know, things within you that could be potentially not disruptive, but be potentially confusing maybe in a counseling session, okay? Or detrimental, of course. Right. So empathic comments. The empathic comment is the message the counsellor sends to the client that they have been heard and understood. Rogers wrote, sorry, I've done that one, haven't I? Empathic includes using. So empathic comments include using a running commentary while the client is talking. This would include encourages and reflective listening. Another approach is to wait until the client finishes speaking and then summarize with reflective statements. I try not to interrupt clients when they're flowing, unless it's excessive. You know, it's an honor when somebody is pouring out the problems, and also it's giving you buckets full of information that you can start to internalize to construct a picture of that person's internal world so that you can start to understand it. So we want to encourage clients to talk. Only when you're overwhelmed and they're going on too long should you intervene and say, okay, you've given me a lot of information. Do you mind if I just come in here because I'd like to perhaps summarize? Okay. And then you can use your empathy. You know, show them that you understand. Not only have you been able to repeat back to them what you're saying, but now, so you've explored and you've listened, but now you're beginning to understand. Is that okay? Lovely. Right. Okay. Empathic listening techniques. Encourages, first of all. These are continuous. They can be verbal, non-verbal, or a mixture. They communicate to the client, I am listening. I want to listen. I understand more about experience. Non-verbal encourages behavior include nodding your head, leaning forward, making sounds like but don't do that falsely because it really is annoying for most people, I think. Facial expressions that are used like smiles and grimaces. All of these non-verbal expressions convey I'm with you. Do you know if you've got good rapport with the person? This is my argument with NLP. They say that, you know, you should learn to do this. You should do it falsely in a sense. If you've got good rapport with the person, you'll do these naturally. You don't have to think about them. Okay. So my advice is listen intently to what the client is saying so that you can heighten your rapport with the client And you'll do these all automatically. Don't have to be thinking about them. You've got better things to be thinking about. When should I nod my head? You know, when should I grimace? That type of thing. Life's not like that, is it? That's not the way we do things. Okay, so verbally encourages, give permission, request additional information, and provide direction. Examples include statements. Can you tell me more about that? That's an open-ended question, isn't it? Okay. Can you tell me more about that? Is inviting a client to give you the privilege of gleaning more information from their life. Or I'm curious about that. Can you elaborate? You know, that sort of thing. And we can do this via non-verbal expression as well. Okay. I'm not going to go into all of that. You can look at that. There's plenty of stuff on the website about that. So reflections, power of reflective listening. The power of reflective listening lies in three distinct forces. As the counsellor processes what the client is saying and reflects it back to the client in his or her own words, which is paraphrasing, it lets the client know that the counsellor has not only heard the client, but has understood what is being said. That actually is a definition of paraphrasing, okay? It's reflection. The emphasis on reflection is the emotion, as I understood it from an emotional point of view, should be there. A lot of these slides I pick up from other sources. Some of them I alter, but some of them I leave in there just to point out the error of the ways as well, okay? So always reflection. When a person talks about reflection, it's from an emotional standpoint. The counsellor is telling the client what he is saying in an accurate way. It is clear the counsellor has been listening, has not distorted what the client has said. Okay, we do make errors in our interpretations. We're human beings. That's one thing a lot of training companies forget. First and foremost, me and you are human beings. We do make errors. We're not perfect. That's why we should have tag questions. Is that correct? Now, if they grimace or they decline your interpretation, it doesn't necessarily mean you're wrong. Does anybody know what else it could be evoking in them? Defense mechanisms. And this is where we've got to be astute as counsellors. We've got to watch facial expressions and body language. And we've got to watch the words they're using. And we've got to determine whether they're employing defense mechanisms. And if they are, note that they're probably frightened. Okay. So that we might not want to push them issues at first. Later on, we may want to push them. We may want to become more challenging. Yeah? We okay with that? Reflections, the power of reflective listening. The power of reflective listening lies in three distinct forces. As the counsellor processes what the client is saying and reflects it back to the client in his or her own words, it lets the client know that the counsellor has not only been heard, but the client has been understood and what is said. The counsellor is telling the client what he is or she is saying in an accurate way. It is clear the counsellor has been listening and not distorting what the client has said. Okay, so it's factual here in a sense. If we're going to do an interpretation which is heavily involved in psychodynamic work, we need to check it out. Then we need to look at the client's response to that interpretation. Okay? As the counsellor reflects back his understanding, the client has an opportunity to hear her or herself in a new way. So again, it's not rocket science, but these are important. It's not the most inspirational of subjects, this. It's not meant to be. It's meant to be the backbone, it's meant to be the core of the skills you're going to use. We do lots of inspirational and insightful stuff throughout the next couple of years. Don't worry about that. But get a grip on these. It's important. Why do we use empathic listening? To show an interest in the client, to encourage the client to gain a better understanding of himself or herself, to support the client in her attempts to resolve conflict. It is therapeutic in and of itself. It leads to an increase in client satisfaction. We use it to discover the client's needs and concerns, to elicit them. In my opinion, the most important reason we use empathic listening is because it maintains the client as the primary problem solver. This is a very, very important point as well, that we're there to empower our clients. And if you go back to Freudian times, it was very, very authoritarian. Therapy was delivered very, very authoritatively, okay, which really pushed the, subjugated the client to, to a lesser mortal, really, okay, which is not right. We want to keep equanimity and power equanimity in the counselling relationship. And we should always, always, always remember that we're not the expert in the client's life. We're experts in what we do, and we're probably able to assist or facilitate is the right word, the clients to get at information perhaps they can't see or can't access. But they're ultimately the experts in their own life. And we must always see the locus of power within the client, okay? Our job is to empower clients. Our job is to make the unconscious conscious. Our job is to honour defence mechanisms and know why they're there, but at the same time nudge away at them with challenging questions. Are we all right with that? Yeah? In my opinion, the most important reason we use empathic listening is to, sorry, we've done that. Okay. Barriers to empathic listening. Cultural differences. Okay, there can be cultural. I'm going to be honest with you, I'm not heavy on cultural differences because my experience tells me, and I know there are exceptions to this rule, but I have spent lots of time training on cultural issues, and I'll be honest with you, when I have a person in for counselling, that's exactly what I see them as, a person, and I've never really known cultural issues to become a major issue in all this time of doing it. Therefore, I feel although they're important and at times they can, affect the counselling environments, we need to be aware of them. I've never felt, I see first and foremost, everybody is just a person. I find that works really well. Okay? So barriers, cultural differences, gender, seeing the client as an object, not understanding your role as a counsellor, that's important. And the main importance really is we get lots of people who, when they're going to enroll on these courses, they say, I'm already doing counselling, I'm a hairdresser, I'm a taxi driver, I'm this, I counsel all my clients, all my customers. No, they don't. It's the first thing they say. They talk to them, they listen to them, they advise them, okay? We don't do that as counsellors. We don't give personal advice normally. Although it's a grey area really, we do give suggestions. So I might say to somebody, have you ever thought about going to AA? That's a suggestion, but it's quite close to advice as well, isn't it? And there is differences in the definitions of them. So we would make suggestions rather than personal advice. We can give we can give advice so long as it's not personal advice, but it's better couched as suggestions. For instance, we would never say, oh, you want to leave your husband, he's a right one, isn't he? That sort of advice is a no-no, okay? In general, counsellors are seen not to advise at all. But I have many of my students dispute this, and they're quite right. They say, well, isn't that advice? Isn't that this advice? And they give me different scenarios, and they're quite right. It's advice. So I think we need to distinguish between the types of advice we give. Maybe you want to go to the citizen's advice about that. It might be that sort of advice, which is quite practical. It's not emotional. It's not a subjective choice that a client needs to me. That must be always client-led. Okay? So you can get a view of your inscape or your inner world. You can, your inner world can become a barrier, obviously, because you may filter. Your interpretation may be distorted by your own filters. You can have preconceived ideas and beliefs. They're people I look out for in the class, people with quite strong, rigid, convicted views. How they gone throughout the class sessions, you know, we're always looking at personal attributes. I don't do this, I don't mark these, I should do, but we're always looking at personal attributes of people. Okay, mark my words, we don't do it overtly, but we'll always be looking at, you know, we'll look at how people react to certain situations. We'll always look at if somebody's quite self-centered. In other words, if they ask a lot of questions and immediately start talking when somebody else, then we're looking at them permanently, because we need to get them to adjust ways of doing. Personal attributes are really important during this course, but we don't set it as an assignment the way I should do. I should mark all them at the end, really. I don't do that. I don't believe in doing it. We rectify them as we go along. Okay. Right. Your preconceived ideas and beliefs. You may be uncomfortable in the presence of a client's strong emotions, grief, anger, pain. Can anybody think why you might be? Can anybody give a reason why you might be uncomfortable with a client's emotions? There's lots of reasons, really, I suppose. But
trigger your own ones.
Pardon?
They could trigger your own ones.
So you may have the likes of transference, you know, where they're seeing you as somebody they didn't like in the past. It's not personal. And we must realise it's not personal. I'm terrible. Honestly, my dad always said, don't let people shout at me. I never let people shout at me. But they can shout as much as they want in a counselling room, you know, unless it's derogatory and, you know, it's unacceptable. I quite welcome it in a counselling room. I think this person is seeing me as somebody else in their past. Who are they seeing me as? That's what's going on in my mind. You know, and often when we're using psychodynamics, it gives us insight into a person's past relationships. Yeah. So there's lots of things. So transference here, they may be seen as somebody else. It may be that we've got unresolved grief issues. Okay. It could be anything, but basically, yeah, that's right, Paul. They're tapping into our own emotional discomfort, and we can become defensive ourselves. So first and foremost, you know, as counsellors, we have to work on ourselves. Now, this course, I've never believed that counsellors should be forced to go to therapy if they don't want to. First and foremost, anybody who doesn't want to go to therapy, I'll be with you now, Leah, I've just seen your hand. Anybody who doesn't want to go to therapy won't respond well to therapy, okay? But what I would suggest to you is, if you do feel that you need therapy because of certain issues, Nicola is offering a package. It's additional money, but it's cheap, okay? And she's offering a package whereby she will see you. So if you feel that you've got issues that need resolving, you can go to Nicola. Nicola's offering the package. Nick also counsels, but he's primarily our external supervisor, Nick. But we have him in as what is called a guest tutor, okay? Because some organisations don't like you having supervisor and supervisor and tutor in the one camp sort of thing. It's nonsense. Leah.
Hi.
Yeah.
Hello. I was just kind of following on from what you were saying, and what Paul mentioned as well about a barrier to kind of open listening with triggering own emotions and feelings, or like even triggering like values that we hold quite strong.
Yes.
But just thinking along the lines of how like sympathy can be very similar to empathy in many ways, and if you resonate with an experience, like a strong experience or a strong emotion, it could trigger that sympathy.
Can I ask you a question, Leah?
Yeah.
How do you define the difference between sympathy and empathy?
Empathy is understanding someone's point of view and just appreciating and respecting it. And my opinion, sympathy would be more along the lines of feeling the emotion.
It's
Feel-
sharing, exactly. So that's spot on. The difference between sympathy and empathy is that we share the feelings, which means that we can get drawn into them. And that then probably lead to collusion with the client, and it doesn't always help. It's not wrong, but it doesn't always help. But we can maintain, with empathy, we can maintain a certain degree of professional distance and understand and be able to work with it rather than being drawn into it. Does that make sense?
Yeah, and just thinking obviously if emotion comes into it, it's hard then to really listen to the client because you're projecting almost.
Yes, yeah, exactly. Yeah, no, good point. I hope we've distinguished the differences between sympathy and empathy, and the reasons that we lean towards, empathy rather than sympathy. Sympathy is more sharing a person's feelings, and when we do that, we're likely to become absorbed in it. We can't maintain a degree of professional distance, and it's not really good. Whereas empathy is understanding a person from an emotional point of view, where we can still keep that degree of professional distance and be able to work with it. Is that okay?